live and on your side. Channel 3's Key News.
Welcome back, everybody. Well, have you heard of the vampire facelift? It's a cosmetic procedure that's been creating a lot of buzz over the last few years, and it's among the so-called lunch break treatments that can be done in less than 1 hour. Here's a look at a patient who tried it for the first time, and just a warning, some viewers may find the video to be graphic.
I've been ready to go since I walked in here.
53-year-old Jill Castro is among the thousands sucked in by the vampire craze.
Are you afraid? No.
No, she may not be falling for Edward from the Twilight movies, but Jill is falling for one of the most rapidly growing cosmetic procedures in the U.S., used to smooth the effects of aging, the vampire facelift.
Some of the deeper lines around my face, there's been a lot of dropping with the years, which happens naturally no matter how good you take care of it.
Local plastic surgeon Dr. Gregory Keller says unlike a normal facelift, this is a non-surgical procedure. With such a unique name, why do they call it the vampire facelift?
Because what we do is draw your own blood, and then the blood is put in a centrifuge, and there's a serum component that's left over, and that has a high concentration of your own platelets.
Your true blood is put into a centrifuge to separate out the platelet-rich plasma, which is then injected back into parts of the face that patients wish to augment, used as a wrinkle filler. The plasma fills volume in the face, but also stimulates the body to produce more collagen and elastin.
What we do is inject some of it into the cheek to fill that in. As this cheek falls, the eyeball looks like it has a pocket underneath it that's a bulge. We want to take that away.
So as he's putting these needles in, are you feeling anything?
I can feel, I think, part of the serum going in. You know, you can kind of feel it sliding under the skin, but it's not painful.
The goal is to restore and maintain a more youthful appearance. We're not trying to make you look 20, but to really restore a lot of the changes that have taken place.
Dr. Keller tells me the procedure takes about 30 minutes and the results are almost immediate. So what are the potential risks with the procedure?
Very few, if any. Platelet-rich plasma is basically an essentially safe procedure, inherently. It's taking your own plasma, so it's free of viruses or contaminants or things like that in a sterile manner, and re-inject it into you, so you're not going to form allergy reactions and things like that.
Here you can see Jill's before and after photos. Subtle differences, but she's pleased with the results and relieved that she only has to do it once every 18 months without going through a recovery process that, well, requires her to look like a mummy.
I think that's the big advantage because, you know, it is time-consuming to come in and get done every few months, and also I think cost-effective-wise down the road, it's really going to make a big difference.
Now, the procedure costs between $800 and $1,500. I recently spoke with Jill a few months now after the treatment. She says she's thrilled with the results, but it is fairly new and not necessarily for everyone, as getting your blood drawn can be uncomfortable for some patients, so be sure to consult with a physician.
Only 4 days.